This is a Q&A with Dr. Megan, the prednisone pharmacist. I'm here to answer questions you might have about prednisone, this amazing medication. What questions do you have? Prednisone is truly a miracle and it can make you miserable. It saved my life. What about you? Is this the best medication ever, or is it the bane of your existence? Post your comments below, your questions, any questions and answers you might have about prednisone. Looks like we've got someone here. What questions do you have about prednisone? Post them right here. Okay. So prednisone is this miracle medication. I personally had to take it. It is a corticosteroid that saved my life, but it came at a huge cost. So I'm going to share that story until you have questions that you post in the chat. So you post those questions and then I can answer them. All right, so prednisone, this is a 20 milligram tablet. It comes in 1, 2, 2.5, 5, 10, 20, and 50 milligram tablets. This is a pretty normal dose, and it is exactly what many people need to help with inflammation, autoimmune diseases, arthritis, lupus, PMR, sarcoidosis. Comment below what you're taking prednisone for. Love to hear what you're taking prednisone for, because then I can target this Q&A to help you and your condition. Okay. Ooh, we have people in the chat. Okay. Beverly from Ohio. Beverly says, why is changing from Medrol to prednisone a benefit? I've been on prednisone for 15 months, high dose. Okay. So Medrol is also known as methylprednisolone. I'm going to show you. I've got one right here. Dun, dun, dun. Methylprednisolone, Medrol. The Medrol is the brand name of methylprednisolone. And you're wondering about switching from methylprednisolone to prednisone. And you're wondering why that would be a benefit. So what's interesting about that is I don't know if it is a benefit. It's basically pick your poison. They're very similar. This, you can see, are 4 milligram tablets. The equivalent dose of prednisone would be 5 milligram tablets. For the most part, they're super similar medications. You just, whenever it would be a prednisone dose, you just multiply it by 0.8 and you get your methylprednisolone dose. It's just 80% as potent as prednisone. So you need less of this to get your prednisone dose. But aside from that, they're pretty similar. They're both taken once a day. This one, the Medrol dose pack, you can see I took it a long time ago. You'd take a whole row of 6 tablets, then 5 tablets, then 4 tablets, then 3 tablets, and 2 tablets, and 1 tablet. And each of those is a day. And so it's just once a day dosing either way. So some people don't have as many side effects with Medrol. Other people don't have as many side effects with prednisone. So it's really, I don't know, it's tricky. Okay, so here was your question. I forgot to post it there. Why is changing? So I don't know why. Thank you for explaining that you take it for EGPA. I don't know any reason for EGPA or any other diagnosis why you'd want one over the other. They're just super similar. The main difference is methylprednisolone doesn't normally come in a pill bottle. It normally comes in a pack. Prednisone has lots of different dosing strategies, whereas Medrol is usually just in the pack. It's possible to come other ways. It just doesn't usually. Medrol also comes as injectable. So you might get an injectable in your rear end, a depot Medrol, and that'll last for a while. Or you could get IV Medrol. Those are some other ways that Medrol can be dosed, but normally the oral is only in this pack. Okay, thank you for sharing that you take it for EGPA. Okay, EGPA is a tough diagnosis. I'm so sorry that you have that. Eosinophilic granulomatosis polyangiitis, I believe, is what EGPA stands for. Oh, that is hard to say and even harder to have as a disease. So what questions do you have? Post them below. Let's see. Ask prednisone questions in the chat so I can answer them for you. I'm Dr. Megan, the prednisone pharmacist. And I personally had to take prednisone for a disease called ITP. And it was so crazy. One day I was a normally healthy person. And the next day I was having a rash. I had little red dots that showed up right here on my neck, chest area. And then they started spreading all the way down my body throughout the next 12 hours. At night, it was just here. And by the morning, it was all the way down to my feet. And then these bruises started appearing that didn't hurt. And even a bullseye rash right here, as if like somebody needed target practice for the vaccine or something. It was so strange that I just had this thing that showed up. My rash didn't itch. It wasn't three-dimensional. It was just these little red dots and bruises that didn't hurt. So I go to my skin doctor, my dermatologist, and say, hey, what's going on? Why is this happening to me? And they're like, I don't know. What could it be? We don't know. And they had no idea what to do. We're going to pause my story because we got some more comments. Ohio Beverly says, I am at a standstill in treatment, switching my biologic and switching this, prednisone and Medrol. May need to change my immunosuppressive now. Refractory EGPA and refractory asthma. I haven't been in remission yet. Oh, Beverly, I'm so sorry. That is super high, super hard to have both EGPA and asthma. And if prednisone isn't working, and you're having to go on a biologic, anything makes sense. Switching to another medication, doing whatever you can to get into remission, because not being able to breathe and having all of those issues you're having, I get it. Definitely follow what your doctor's saying and find that. Okay, J. Marty says, I'm weaning down from 2 years of prednisone, 30 milligrams down to 10 now. Is it normal to have different side effects at different doses? I love this question. This is great. I definitely agree that it is normal to have different side effects at different doses. For example, there are a lot of side effects that get really bad the higher you go. The worst example is what prednisone does to your brain. So at high doses, especially 60 and above, most people will have mental health side effects. Most people will either get anxiety, depression, psychosis, just mood changes, just erratic moods, just switching from high to low really fast. And that is so normal at really high doses of prednisone. Whereas when you get to like 10 to 20 milligrams, less people will have those side effects. And then at 5 milligrams and below, it's less common. Not everyone is going to have it. Whereas at 60 and above, most people will have some sort of side effect like that. So Jay Marty, I'd love to know what side effects you're noticing that are different at different doses. I'll go through a few more that you might notice. Eye complications. So like at super high doses, it's more common to have high pressure in your eye. It's called glaucoma, and blurry vision and cataracts, especially higher doses and longer term. And then your heart. So it's more likely to have erratic beating of your heart. That's called an arrhythmia at higher doses, whereas at lower doses, it's not as common. In fact, these can be fatal. Like at super high doses, often people need to be hospitalized so that the doctors can monitor your heart. Make sure you're not going into a terrible arrhythmia. In this situation, it's probably for something that is life-threatening, like for multiple sclerosis, when people's eyes are starting to go, like the autoimmune is attacking their vision. And so, uh, back to Medrol, there's often injected depot Medrol or injected Medrol or another form of steroid, maybe hydrocortisone, at 1,000 milligram equivalent. And that is humongous. Once a day for 3 days or even 7 days. And when it's that high, they want to make sure you're not going into arrhythmia. So they want to prevent that complication, or at least be able to catch it and give you the proper treatment that you need inside a hospital. Okay. So yeah, different doses can definitely have different side effects. Okay. Jay Marty says, by eating lots of fermented foods, I've kept my A1C below 6.1. That is fantastic. There are some other things you can do to keep your A1C low while on prednisone. To keep an A1C, if you don't know what it is a 3-month measurement of your blood sugar. Basically, how likely you are to go into full-blown diabetes or worse diabetes. And it's just this measurement that you can get a blood test, and they can see where your blood sugars have been for the last 3 months. And prednisone is notorious for causing high blood sugar. That is because, I'm going to just tilt this down so you can see me a little bit better with the words there. The reason prednisone is notorious for high blood sugar is because it is actually even named for this side effect. The class of drugs, prednisone, Medrol, and hydrocortisone, they're all named glucocorticoids. Gluco meaning glucose, meaning sugar. And because they are known to cause high blood sugar. The idea is that Mother Nature has created a natural hormone in our body called cortisol, and scientists mimic cortisol using these drugs and super duper high doses compared to what your body normally has as cortisol. And the reason Mother Nature has us release cortisol is in situations of dire stress, things that we absolutely need something to save us. And so we need to be able to run away from a tiger. And so Mother Nature releases releases sugar into the blood from the liver, from muscles, so that you have enough energy to run away from a tiger, to run away from a war, to get to the next food source in a famine. Whatever it is, Mother Nature wants you to have the energy to be able to survive. So you have your A1C below 6.1. That's fantastic. Other things you can do is, if you understood what I was saying, so that you can run away, getting exercise can help keep your A1C, our blood sugars, or chances for diabetes lower, because it's directly using the sugar in your blood and shoving it into your muscles and giving it the chance to use that sugar to work out, to lift weights, to walk, to go on a bike ride, whatever your form of exercise is. It's really wise to do that while on prednisone for supporting your blood sugars. The next thing is that there's evidence showing that prednisone can decrease the amount of a mineral in your body called chromium. And chromium is important to keep an A1C low, because you need chromium with insulin in order to put that glucose into the muscle or the cells that it is needed in. So you've got to have enough chromium to keep the blood sugar stable. But prednisone's making you pee out chromium. There's increased amounts of chromium in the urine of people on prednisone. And your body doesn't normally have very much chromium to begin with. And so this metal mineral that is normally a trace mineral is now a depleted mineral, and you don't have enough of it. It's like a plant that was normally green and beautiful is now turning yellow and wilting because it's missing nitrogen. Well, this is like your nitrogen, it's chromium. And so you need to give back the chromium that your body is losing, depleting, peeing out, artificially ruining your blood sugars because you're taking this pill for me to save my life, for you to treat your other things, EGPA, COPD. So you'd want to replenish chromium. And there was a study done by Israeli researchers 25 years ago, and they showed that you could reverse diabetes caused by prednisone by replenishing chromium in a special kind called chromium picolinate. So everyone on prednisone should be taking chromium picolinate to keep stable blood sugars and your A1C below 6.1. And I love chromium picolinate so much that I included it in my supplement, Nutranize Zone, which you can find at nutranize.com or on Amazon. And I invented it because I wanted to give back that chromium plus other nutrients that you need. For example, those that are in your bones, prednisone is stealing them. And so you can get them here at Nutranize. And then the bedtime bottle comes with melatonin and magnesium to help you feel calm and restful so you can actually get sleep at night. And so it's a combination of restful sleep, healthy metabolism, and strong bones. So you can get that. Just click this link or the QR code. Just take a screenshot for this QR code. And then let's go back to the chat. So Ohio Beverly continues to say, I have steroid-induced diabetes. There we go, which is out of control, and have tendon tears in my hip and cartilage tear in my hip joint. Ortho thought it was AVN. Fortunately, not AVN. Let me translate that all into English so y'all understand. So Ohio Beverly has steroid-induced diabetes, which I was just saying those Israeli researchers said you can reverse with chromium picolinate, which is in Nutranize Zone. Out of control. I hope you've got chromium picolinate on board. And then you say you have tendon tears in your hip. That is terrible. Prednisone is known to destroy collagen, whether it's in your skin, leading to skin. What are they called when you stretch your skin? What is the word? Skin, whatever. Stretch marks. That's the word. Prednisone leads to stretch marks because of the loss of collagen. Makes your face, your skin all over different, makes you feel old, makes you look old. And then it can lead to tendon tears and cartilage tears because the whole muscle cartilage situation is being depleted. Prednisone's stealing muscles. And I'm so glad to hear it's not AVN. If anybody's not knowing what AVN is, I don't blame you because it's a very rare but horrific side effect of prednisone. It stands for avascular necrosis. Essentially, if you know what necrosis means, that means death, and avascular means no blood. It means there's no blood to the bone, leading to bone death. The bone, it's usually the hip joint. It could be the shoulder joint as well. But basically the top of the bone in your leg, the long bone of your leg, it doesn't get any blood flow and it starts to die. And that's a very infrequent, rare, but terrible side effect of prednisone. So I'm so glad you don't have that, Beverly. Okay. And then you have one more question. I am now on 40 milligrams daily and had an infusion today and I had IV Decadron today. Is that dangerous or cause any issues mixing those? So Decadron is basically the same thing as this. Decadron and methylprednisolone and prednisone, they're all related. They're all sister drugs. They're all glucocorticoids. They're all corticosteroids. Decadron is the generic name dexamethasone. So prednisone, dexamethasone, methylprednisolone, they're all the same like almost the exact same molecules, but just a few tiny differences. So it should be fine. If it sounds like you must have something horrific going on, if your doctor's giving you IV Decadron in addition to 40 milligrams of prednisone slash methylprednisolone. So there's no danger in mixing those because they're essentially the same thing. But just know you're probably not going to sleep well tonight because it's going like they've shown that one dose of Decadron is enough to completely turn off your sleep wake cycle. So that's another reason why I have the melatonin in the bedtime formula, because that's part of your sleep wake cycle. You need to be giving it back. So that's why that is. All right, now we have Jeff. Jeff Dice said, can you comment on intermittent or pulse use, e.g. a relatively high dose used for just a few days when symptoms begin to appear? Great question, Jeff. So intermittent or pulse use is something that people might use for asthma, for eczema, things that kind of wax and wane that might get really bad and just a few days will make it go away. Maybe gout. A few days of it will just kind of turn off the inflammation, and then your disease will be okay. And then you stop taking it because you don't need it anymore. It kind of, put out the fire temporarily. There might be some sizzling underground, but it doused it for a moment. And that's okay for those situations. And what you need to realize, though, is that if you take more than 21 days worth of steroids per year, that is enough steroid to turn off your HPA axis, the part of your body that is the adrenal system, hypothalamic pituitary adrenal system, your ability to actually make your own cortisol. And so when you are doing this intermittent or pulse use, if it's more than 21 days per year, you need to actually be tapering. You can't just go cold turkey after like 3 days. You need to go slowly off of it. Unless you have like permission from your doctor and you're working closely with them. Otherwise, you can go into adrenal crisis, adrenal insufficiency. You can go into multi-system organ failure. You don't want to do that, multi-organ system failure. Anyway, you want to be so careful with this. This is something you definitely need to work closely with your doctor about, because it can be fine in those situations where you need like 3 days every couple months for your asthma or whatever. Great, fine, do that. But if it's more than 21 days, you've got to taper and work with your doctor to get off safely. It's really important to be safe. Okay. All right. We have a few more comments, questions. Jay Marty says, we already read that one. Jay Marty says, I had to have a hip replacement, which was AVN, but arthritis already there before prednisone. Oh my goodness. Wow. So we have a super rare side effect that someone else was hoping they didn't have. Their doctor decided it wasn't. And now Jay Marty says, you actually have AVN. And a hip replacement is the only way to deal with this, because the bone is dead. Like with the bone being dead, you can't walk. Like your hip doesn't work. It's horrific. And I know of people in their 30s who've had to have this replacement. I even know of one child who got AVN. Oh, that's just so terrible. A person still growing who got it and had to have a hip replacement. And that means they're going to have another hip replacement when they're fully grown. Terrible. Okay. Ohio Beverly says, I had an IV and fed infusion, and Decadron was a pre-med. Okay, that makes more sense. Yes, Decadron is commonly a pre-med for lots of different, whether it is chemotherapy agents or other things that can cause lots of nausea or other side effects. They can actually use the Decadron as a side effect preventer. It's kind of crazy when we know that prednisone, methylprednisolone / dexamethasone cause more side effects than any other, but they might not be as severe as chemotherapy side effects. So we give Decadron. Oh, Beverly says, that is awful. Yes, that is truly awful. Okay, what other questions do we have? Ask prednisone questions in the chat. I want to hear what you have, what you're worrying about, what your questions are, so I can help you solve your prednisone conundrums, because this super old drug has no drug rep. There's no like prednisone website that is run by a drug company. It doesn't exist because it's such a super ancient old drug. It is older than my dad. That is really old. And what's funny is that year that prednisone was invented, my grandpa started the family pharmacy. My dad was born, and he's a twin. So my grandpa went from being an employee to being a store owner to being a father of twins. He already had other kids, but he became a father of twins all in 1 year. And prednisone was invented that year. It was the coolest year ever. My life would not exist. My job would not exist had 1954 and 5 not happened. So what other questions do you have about prednisone? Okay, Dreadplay says, can I ask one? Yes, please ask. Does pineapple belong on pizza? Yes, sir. Dreadplay, pineapple belongs on pizza, especially if you're ordering Hawaiian pizza. But I don't know how that has anything to do with prednisone. So I'd love to hear any other questions people have about prednisone. Any other questions? Okay, so far we've covered today avascular necrosis, which is like the most rare side effect. And yet, of the people who've shown up today, someone actually had it and had a hip replacement. We've talked about diabetes, A1C, high blood sugars, and how chromium picolinate can help with that, which is where you need Nutranize Zone. And you can get that at nutranize.com or on Amazon. And this I invented helps support you while on prednisone. It gives back the calcium you need for your bones. It gives back the melatonin you need to get restful sleep with a bedtime bottle. And it gives back the chromium picolinate you need for stable A1C and blood sugars. So this is exactly what you need while on prednisone. Just scan that QR code and it'll take you to exactly where you can buy Nutranize and feel like yourself again while taking prednisone. I have a 100% money back guarantee. If you don't like it for any reason at all whatsoever, just send me an email or contact us, nutranize.com, and I will refund you. All you have to do is take 2 in the morning and with your prednisone dose, and then 2 at bedtime. And that's how you're going to feel like yourself again while taking prednisone. It also has vitamin D, vitamin K2, MK7. So that D3K2, it's in there to support your bones, to support your immune system. There's vitamin C in there and zinc to support your immune system as well. And there's B vitamins to help you have strong, good energy levels. So this is basically the fertilizer you need to keep the grass that is you lush. I know my grass was looking pretty patchy, yellow, thin, and ugly. And then the lawn doctor came, spread his magical green potion on there, and it looks amazing. My neighbors were like, "What did you do to your lawn?" I was like, "We hired the lawn doctor. They put the fertilizer exactly what my lawn needed, made it look fantastic again." This is what you need while on prednisone. It is the fertilizer to make you feel lush and green and beautiful again. So just go to nutranize.com or scan this QR code, and it's exactly what you need to feel like yourself again. All right. Any other questions? Okay, we have some more questions. Mohammed says, I'm taking 5 milligrams of prednisolone daily. My age is just 25 years. How long can I take it? I don't want to quit this medicine as it's a magical drug. Ooh, you are stuck. I'm going to take a quick sip. You're stuck in this place where it's still a magical drug to you. until all the side effects kick in. And you might feel 25 years old now, but the longer you stay on prednisone, the faster it's going to age you. You're going to feel like a little old man or old lady soon if you stay on prednisone super high doses for super long. Luckily, 5 milligrams is just kind of a normal lowish sort of dose. And so you could be on this for the rest of your life, and that would be okay. It does increase your risk for osteoporosis, heart disease, diabetes. But if it's allowing you to live a life to actually be 25 years old, then that's great. But if it's you're worried about the side effects, then getting on the lowest effective dose possible is wise choice. So for some people, 5 milligrams is good. For others, they can get down to 4 or 3 or 2.5 and still get the magic. But because the number of milligrams over your lifetime really matters when it comes to your risk for heart disease and other side effects. So you can take it the rest of your life, or you can take it as short as possible. The guidelines say to take the lowest effective dose for the shortest time possible. So it's really between you and your doctor how long you can take it. Most doctors try to get you off prednisone as soon as possible. Beverly says, docs discussed putting me on hydrocortisone when tapering. How does that work and why? So I can see that's a possibility. So Beverly was on prednisone, switching to methylprednisolone, and thinking about hydrocortisone. So the difference between these two and hydrocortisone is these two are once a day pills. They last the whole day. By the time you go to bed, they've worn off and you just sleep because the side effects have worn off. Whereas hydrocortisone is a much shorter half-life. And so you'd have to take it multiple times a day. For some people, that's 2, others it's 3, and some it's actually 4 times a day that you'd need that dose. And some doctors think that it's better for tapering, whereas others don't think that. The reason they might think that is because you can kind of finely dose it. Like I can take 10 at upon waking at 7 a.m. And then I can take 8 at lunchtime. And then I can take 6 at 3 p.m. or whatever. And they can just be very nuanced in the dosing. But others realize that it's kind of this spike drop, spike drop, spike drop. And it's there's a lot of controversy basically about whether that's better or whether prednisone is better or methylprednisolone. So it depends on what doctor you talk to, whether that's a good idea. Yes, and Dreadplay, this is about prednisone. Okay. All right. Jay Marty says, my doctors have been amazing at coordinating my care. Found out it was lung fibrosis caused by long use of nitrofurantoin. No way. You got fibrosis from nitrofurantoin? So for those of you who don't know, nitrofurantoin is an antibiotic. Often people are on it for a long time to prevent UTIs and urinary tract infections, a low dose for a long time. I've never heard of anyone getting lung fibrosis. I'm not an expert at nitrofurantoin, but I'm so sorry. That is terrible. Okay. Does prednisone kill you? Not immediately, but it's basically taking a rapid aging potion. You take it and you feel good, but then it starts to withdraw you and make you feel old and miserable. Tercia says, can I do high intensity yoga or is it too much for long-term 15 milligrams of pred? So it depends on what you mean by high intensity yoga. I would not do an Ironman or a marathon, things that are extended and are going to do serious things to your muscles. Yoga is kind of a gray zone because if you're doing serious stretching, let me think about this. I think you need to be pretty careful about yoga because prednisone is causing muscle depletion. So it's taking the muscles from your arms and legs, the nutrients and the density from your muscles and your bones, and redistributing it across your body as moon face and belly fat. And it's affecting your muscle. So, like, not only your muscle density, but like the strength of your muscle and bone fibers, but muscle fibers and bone density. And it's making you weaker in general. So I would be careful with high intensity yoga. Just like really don't push yourself too far, because someone else earlier in this stream was talking about how, let me just read what this person said. Right here. Tendon tears and cartilage tear. So we don't want that. Be so careful. Okay. Oh, Ohio Beverly says, I appreciate your knowledge so much. The world needs more of you. Thank you. Katie says, hello. George says, I took Medrol 16 milligrams times 3 last year for 10 days because I had cataract surgery at the age of 46. That's way too young. To chronic anterior uveitis. Wanted to say hi. I've been following you for a while. Hi, George. So good to see you. From Greece. Wow, that's fantastic. We've got Greece here. We've got Mohammed, I believe, was from another country as well, because taking methylprednisolone or prednisolone. Katie says, can a woman in her 60s take 80 milligrams for a week and stop after a week? If only taken for a lower left infection, but it's not a bad infection in the lungs. Okay, so 80 milligrams is a huge dose. Like, that is huge. But if you have taken 0 other steroids for this entire year, it is possible that a doctor could prescribe 1 week of 80 milligrams. That is a possible prescription from a doctor. Whether or not you should do that is up to your doctor. But a doctor could say 80 milligrams for 1 week, stop. Not everyone can stop, though. Some people actually need to taper at that point, because that is such a humongous dose that it might be too much for you to taper at that rate. So it's really dependent on listening to your body. If you feel awful, feel like you now have a new infection, you have no energy, can't get off the couch, incredible fatigue, muscle weakness, and things like that, then you might be in prednisone withdrawal, and then you would need to taper at that point. Okay, Katie said, I called your number on your website. I hope you can call me. I have some major questions about your mother. Okay, yeah. Call me. You can also set up, if you want me to be for sure available, you can set up a consultation with me, and I will put that here. This is where you can set up and go to this website to set up a consultation with me. And I'm going to make that a QR code too. Add. Nope, not this moment. Okay. So that is where you can go to set up a consultation with me if you'd like to speak in depth about your personal situation with your mother or your own personal health. Okay, Christy Cook Britt says, I also have AVN. What is happening? Oh my gosh. 2 people on here have AVN. That is mind-blowing to me. This is supposed to be like a 1 in 10,000 or like even rarer side effect, and 2 people are on this live stream with this. This is mind-blowing to me. Okay. Christy has AVN and arthritis. I saw an orthopedic surgeon today for the first time. Been on prednisone continuously since 2003, getting a hip replacement soon, reversing prednisone-induced diabetes. Oh my goodness, Christy. You really have had to pay for being on prednisone continuously since 2003. The AVN, bone death leading to a hip replacement, causing diabetes as well. Oh, and so back to what I was saying earlier, if you want to know the best thing for prednisone-induced diabetes, it's the Nutranize Zone, has chromium picolinate in it. So go to this QR code to get Nutranize Zone. I invented this supplement using my doctor of pharmacy training as a third generation pharmacist. And I put in there everything you need to support your body while on prednisone, support your bones, support your metabolism, support your sleep and your mood. So you can find it there. Okay, back to the chat. Katie, okay. All right, please let me answer this question. She passed away 3 weeks ago. And we think it was from this. There's no way, but I'd love to hear your opinion on how does that like with other health issues. Yeah, definitely reach out to me at that link I posted. Okay, oops. Other health issues and medication she was on with such a high dose of it that it may have affected her. Yeah, prednisone can definitely cause fatal side effects, whether it's an arrhythmia, diabetes, adrenal insufficiency leading to adrenal crisis, leading to death. Like prednisone has lots of ways it can kill you. And it's sad because it's not monitored very well. That people are like, oh, they died. And it's like, well, why did they die? And it's rare that they trace it back to the prednisone, but prednisone is often a cause. Okay. Christy Cook Britt, I'm sorry. I totally feel for you. You will be in my thoughts. Yes. Yes. I'm so sorry for everyone who has suffered side effects from prednisone. I have too. It is horrible. Okay. Katie said, we think that's what killed her. Yeah. Okay. Mary Jane Lane or Laney. I'm not sure how you say the last name. Dr. Megan, you were describing what I feel about muscle weakness. I've been on 5 milligrams of prednisone for about 15 plus years. We tried to lower it, but because I have arterial arteritis, we raised it to 5 milligrams. Oh, you are stuck in that taper trap where you want to get down so that your side effects can be better. You don't have so many, but you can't get down because your disease isn't under control. And it's this really tricky balance trying to find, okay, where's the lowest dose? So for the side effects, but the lowest dose that keep my disease under control is so hard. And so muscle weakness is real. You can talk to a physical therapist about this or a physiotherapist in other countries. They can help restore muscle strength, teach you training, give you training for getting strong again, getting enough protein in your diet. Taking Nutranize Zone is going to give back those other things you need. So definitely. Okay. Christy Cookbritt says been using NZ since March. NZ, I believe she means Nutranize Zone. Yes, I love it. I'm so glad to hear that, Christy. This is exactly what you need to support your body while you're on prednisone. Okay, Christy, a hip replacement is pretty easy. Go for a week of inpatient rehab. Yeah, that is the way to do a hip replacement. I've heard some people, it's a pretty quick recovery for some people. For others, it's a couple, weeks or couple months before they're feeling recovered. Mary Jane continues to say, I have osteoporosis being on prednisone for so long. Yeah, it is definitely a side effect that happens, especially if you're a woman who's postmenopausal and on prednisone for a long time. But again, back to why you need Nutranize Zone. This has exactly what the doctors recommend who prescribe prednisone the most. The glucocorticoid-induced osteoporosis guidelines by the American College of Rheumatology. They recommend that you take calcium and vitamin D. I've got those in here, exactly what you need. And I would add to that vitamin K2, MK7, and magnesium to make sure that calcium isn't hardening your arteries, but is going to your bones so that you have all the nutrients you need to strengthen your bones and that the calcium isn't unopposed and you're giving all of the every ingredient that you need for bone strength. Okay, Katie said, thank you so much. She had heart issues too. Her eyes burned and her head hurt bad the night she passed. Oh, what a miserable way to go. I'm so, so sorry, Katie. Her eyes burned. Ugh. That is terrible. Okay. And Katie continues, we wonder if she went into the crisis that night. Yeah, definitely could have. That is often How somebody on prednisone would die is adrenal crisis. Okay. And then, yeah, Katie, you've been typing really fast. It's okay if there's a few typos. That is all right. So, uh, Christy, I'd love to hear any feedback you have about Nutranize if you've been on it this long. And then Katie, okay, we have Ohio Beverly saying, none of my specialists at Cleveland Clinic recommended any supplements. I would say there's a missing educational link there. I completely agree. Definitely a missing educational, like they did a study of how many doctors prescribed calcium and vitamin D in addition to the prednisone, to see like how good the doctors were at giving people the care they needed. And it was dramatically low. It was something like 20%, or maybe, I don't know. It was a terrible percentage of people, but I want to show you this guideline because it's real. Like, I'm not making this stuff up. This is glucocorticoid induced osteoporosis. Okay, I'm going to guideline. So this guideline, it has lots of things on there, not just calcium and vitamin D. There's other stuff on here. Let me see if I can share my screen. Share my screen. Okay, so I'm going to try to make this as big as I can. Okay, so it was revised in July of 2023. And close this, make it even bigger. 11. Okay, so on here, it talks about calcium. So right here, so this was the guideline summary. We recommend optimizing dietary and supplemental calcium and vitamin D in addition to lifestyle modifications. And that is for anybody taking 2.5 milligrams a day for 3 or more months. That is what they say. And then Calvit. So then that's anyone. Now, adults greater than 40 years, they're saying everything below is recommending that you've already done calcium, vitamin D, and lifestyle modifications. So everybody over 40, everybody on high dose, adults less than 40, in addition to calcium, vitamin D, and lifestyle modifications. Like, they want everybody taking it. And then let's see. Vitamin. Okay. And they're saying optimize your dietary and supplemental calcium and vitamin D based on age-appropriate U.S. recommended dietary allowances, which I agree the U.S. recommended dietary allowance is appropriate for calcium. But what I loved about their update, so they had an update in 2024. And in this situation, they caught up with the latest when it comes to vitamin D. And I'd like to talk about that now. So vitamin D, they now recommend that you get it tested to make sure that it is in the right range. Like, this is breaking research in so many diseases. I geeked out, and I'm going to go way in depth another day, that in diseases like IBD, irritable bowel disease, PMR, polymyalgia rheumatica, asthma, COPD, so many diseases, they've figured out that the people who are the worst, have the worst recovery, have the worst symptoms of their disease, have low vitamin D. And that the people who recover the fastest are those who can replenish that vitamin D the fastest. And so, like, everybody needs to be testing their vitamin D. So if all you do today is say, hey, doctor, please test my vitamin D, to see if you're 20 or below, like no wonder you're not recovering. You need to be getting it up to 40, hopefully between 50 and 70 on the vitamin D blood test. So that is my best tip. Okay. Let's see. Prednisone has given me dry eyes and dry skin. Living proof of the damage. Yes, you are. Oh my gosh. Okay, I love this question, Jay Marty. I asked my pulmonologist about taking supplements for side effects. My question was, if it helps the side effects, does it decrease the beneficial effects? So supplements like Nutranize help with the side effects by filling up the gap that prednisone has caused. Prednisone has been stealing the nutrients, and so this fills it back in, so you are replenished, that you're stable, that your nutrient levels are repleted. And it doesn't decrease the beneficial effects because it's not fighting against the prednisone. It's just giving back what was already there that prednisone is stealing. So that was a great question. Katie says, can bring on Farxiga be bad to be on high dose of that with heart issues? Farxiga is a great med, but when a person has diabetes and heart issues, it's hard to know what was the cause. And Jay Marty says, he said it was a good question, but he didn't have an answer. Yeah. So if it's a supplement like Nutranize that has been like designed specifically to go along with prednisone, then it doesn't decrease the beneficial effects. But other supplements might decrease the beneficial effects of prednisone because some supplements cause a drug interaction. For example, turmeric / curcumin, that amazing herb spice coloring, yellow coloring, has a drug interaction with prednisone that can increase the risk of bleeding and other side effects. And so it's, I guess that situation, it is not decreasing the beneficial effects, but there are others. Ashwagandha, potentially, licorice root, possibly. These can actually fight against the way prednisone is working because those are both cortisol. They both affect cortisol, and prednisone is mimicking cortisol. And so it's like, definitely avoid turmeric, curcumin, ashwagandha and licorice root, especially the non-deglycerized version, while on prednisone, because they do fight against the good parts. Okay. Ohio Beverly, wasn't that the same with COVID in 2020 with vitamin D? Yes, exactly. That the people with the lowest vitamin D level were at the risk for the worst outcomes from COVID, right? Like there was one article saying that vitamin D is a risk factor for fatal COVID infection, for COVID becoming to kill you. Like it was one of the leading risk factors. So vitamin D is so important. Like it is autoimmune. It can help minimize autoimmune. It helps with stabilizing your immune system. It helps with your bones. It helps with your energy. It helps with so many things in your body that when your vitamin D is low, it's like, no wonder you're having an autoimmune flare. No wonder you feel awful. And so the easiest way to get vitamin D is to go outside in the summer sunshine and get some skin. But often that's not enough because older people, the skin isn't as good at converting sunshine, allowing the sunshine to convert the vitamin D into the active form. So often it's not enough. So often supplementation is necessary. Okay. All right. Well, that's all I've got time for today. Thanks everyone for joining me. This was sponsored by Nutranize.com. You can get Nutranize, the first and only supplement for people on prednisone, at Nutranize.com or on Amazon. Just take a screenshot right now of this QR code. It'll take you straight to Amazon, or you can go to Nutranize.com and get the support that you need while on prednisone today. Signing off as Dr. Megan, your prednisone pharmacist.